Eating disorders are conditions defined by abnormal eating habits include extreme emotions, attitude, and behavior surrounding weight and food issues. They are serious emotional and physical problems. Eating disorders are serious conditions related to persistent eating behavior that negatively impact your heart, your emotion, and your ability to function in important areas of life. The most common eating disorders are Anorexia Nervosa, Bulimia Nervosa, and Binge eating disorder. This may be eating too much or too little food, or eating a lot of food in one sitting. You may become obsessed with food and your eating pattern if you have an eating disorder. Anyone can develop an eating disorder. It doesn't matter what your age, gender, culture, or racial background is. Most eating disorders involve focusing too much on your weight, body shape, and food, leading to dangerous eating behaviors. This behavior can significantly impact your body's ability to get appropriate nutrition. Eating disorder can harm the heart, digestive system, bones, and teeth and mouth, and lead to other diseases.
Okay, Assalamualaikum. I'm Haizan Adha. I will talk about sign and symptom. Okay, common type of anxiety disorder include Anorexia Nervosa, Bulimia Nervosa, and Binge eating disorder. Okay, what is Anorexia Nervosa? Anorexia can affect people of all ages, gender, sexual orientation, race, and ethnicities. Historians and physiologists have found evidence of people displaying symptoms of anorexia for hundreds or thousands of years. To be diagnosed with anorexia nervosa, the following criteria must be met. 1. Restriction of energy intake relative to requirement leading to a significantly low body weight in the context of age, sex, developmental trajectory, and physical health. The second, intense fear of gaining weight or becoming fat even though underweight. And third, disturbance in the way in which one body, weight or shape is experienced, undue influence of body weight or shape on self-evaluation, or denial of the seriousness of the current low body weight. Even if all the criteria for anorexia are not met, a serious eating disorder can still be present. A typical anorexia includes those individuals who meet the criteria for anorexia but who are not underweight despite significant weight loss. What is bulimia nervosa? Bulimia nervosa is an eating disorder in which people have episodes of overeating. After overeating, people then attempt to get rid their bodies of the food and avoid gaining weight. Okay, I will talk about the symptom and health problem bulimia nervosa. Bulimia nervosa is more common in women than men. It usually begins in the teen or early adult years. Many people with bulimia nervosa are a normal weight for their height because their weight appears normal. Other people might not know that they have an eating disorder, but it's important for people to get treatment because bulimia nervosa can cause serious problems. Other symptoms of bulimia nervosa: people with bulimia nervosa binge at least once a week for 3 months or longer. During binges, people eat much larger amount of food. When they overeat, they usually feel out of control, guilty, afraid, or shame. Purge or exercise after they eat to avoid gaining weight after overeating. People make themselves vomit, exercise too much, use medicines such as laxative, diuretic, or enemas after eating to make themselves throw up, urinate, or defecation. Living in fear of gaining weight, judge themselves based on their weight and body shape. They feel good about themselves if they are thin and feel bad about themselves. In this video, I'm going to talk about the danger of binge eating. Binge eating is not just a habit. There is an actual disease called binge eating disorder in which you eat abnormal large amount of food with an inability to stop eating when your body is technically full. This is dangerous, life-threatening condition, but help is available and recover is possible. Why you can overeat every once in a while? Binge eaters consistently eat too much but do not use laxative or purge to get rid of the food. Many people who have binge eating disorder have weight problem, but some are of a normal weight. Signs and symptoms of having binge eating disorder include the following: having out of control eating behavior, eating huge amount of food over a short period of time, eating when you aren't hungry, eating rapidly when you binge eat, eating in secret or when you are alone, feeling ashamed, guilty, or depressed about your eating behavior, always going on a diet, usually without success.
Assalamualaikum, my name is Muhammad Fikri bin Nazaruddin. Now I would like to explain the way and factor of the symptom by my team members from Mr. Azil about anorexia, bulimia, and BAD. Let's go.
Anorexia Nervosa. People with anorexia have extreme fear of gaining weight, and they will try and stop this fear by starving themselves over exercising, and basically eating as little as they possible can. People with anorexia are consumed by waiting to control their body weight and size. So with anorexia, you extremely retrieve food and equate illness with self-worth. This eating disorder can usually break down your physical and mental health to the point that it can be fatal. By starving your body, you can deal with an abnormal low heart rate, increased rate of heart failure, hair loss, feeling cold all the time, losing your period, distraction, losing muscle, feeling weak and fatting a lot, abnormal blood counts, lastly, you die. Bulimia nervosa. Dehydration. This is when the body loses too much water. This can make people feel dirty, tired, dizzy, or confused, and have dark yellow urine. Vitamin deficiency and low level of sodium, potassium, and magnesium in the body, feeling very tired. Irregular menstrual period in women, belly pain, bloating, and problem having small group. Damage to the esophagus, damage to the teeth, gum, or cheek, problem with the heart, kidney, and blood. People with bulimia nervosa can also have depression. This is when the people feel very sad, in pain, and hopeless more of the time, or do not enjoy the thing that usually make them happy. In addition, people can have problems with their appetite, energy, memory, or concentration. Some depressed people think about hurting themselves. You can stop eating. Binge eating disorder. Risk of BAD have three. Arthritis, a painful form of degenerate arthritis in which a person joint degrade in quality and can lead to loss of cartilage. Second, chronic kidney problem or kidney failure. Third, high blood pressure and high cholesterol, leading to increased risk of stroke, diabetes, and heart disease. Thank you for watching. Now we can start another video.
Assalamualaikum. Welcome to Fire Brothers Healthcare. My name is Muhammad Zaki. Our group topic is eating disorder, and for my part, I will present to you for subtopic which is causes of eating disorder. An eating disorder is a mental disorder defined by abnormal behavior that negatively affect a person's physical or mental health. Type of eating disorder include anorexia nervosa, bulimia nervosa, and binge eating. Causes. Many people with eating disorder also have body image disturbance and comorbid body dysmorphic disorder, leading them to altered perception of their body. There are also many other possibilities such as environmental, social, and interpersonal issues that could promote and sustain these illnesses. Also, the media are oftentimes blamed for the rise in the incidence of eating disorder due to the fact media image idealize slim physicals such as models and celebrity, or even force people to attempt slimness themselves. Genetics. Studies show genetic predisposition toward eating disorder. They are heritable. About 50% of eating disorder cases are attributed to genetic. An individual who is first degree relative someone who has eating disorder is 7 to 12 times more likely to have an eating disorder themselves. Psychological. There are various psychological issues that may factor into eating disorder like depression, substance abuse, alcoholism, anxiety disorder, obsessive compulsive disorder. Environmental influences. Child abuse. Child abuse, which encompasses physical, psychological, and sexual abuse, as well as neglect, shown triple the risk of an eating disorder. Social isolation. The loneliness of social isolation and the inherent stress is triggering factor in binge eating as well. Cultural pressure. Athletes and eating disorder tend to go hand in hand, especially the sport where weight is competitive factor. Gymnastics, dancing, horse riding are just a few that fall into category of weight-dependent sports. To be competitive in a world of sports lead them to taking extreme measures to maintain their younger body shape. That's all for my presentation for causes of eating disorder. Thank you.
For the prevention of eating disorder, I want to promote to all the parents to healthy develop their children before occur eating disorder. The trend eating disorder for kids is frightening. We see the trend now. Younger ages are found very deadly disorder. Family can start teach children from the age 5 until 7 years old. Because in this age, they start understand and aware of the culture messages regarding body image and dieting. 3 methods I suggest as prevention children to avoid eating disorder. Number 1, building healthy eating habit. Number 2, fostering good self-esteem and body image. Number 3, understanding the risk factor. First, set a good example by eating well. Parents need to become a good role model. Eat regular nutritious meal and choose healthy snack when you get hungry between a meal time. Other good habits to demonstrate include eating a variety diet that include lot of fruit and vegetable, limited sugar, processed and greasy foods, and last, taking time to enjoy and celebrate your meal, especially with family and friends. Number 2, encourage your children eat when they are hungry. Try to talk to them about how to listen to their body and recognize the signal that they are hungry or full. Discuss how being mindful when eating can help them meet their body needs and avoid over or under eating. Number 3, avoid making negative or shaming comment about food and eating. Help your children maintain a healthy relationship with food and eating by focus on the positive. Don't make critical or judgmental comment about what the other things eating. And also avoid talking negative about your own eating habit. Number 4, keep healthy food around the house. If you are concerned about the eating habit of your children, make sure they have access to plenty of fresh nutrition food. Keep your fridge and cabinet stocked with a lot of fruit, vegetable and healthy snack options. The second method is fostering good self-esteem and body image. Okay, first, talk to the children about their strength and achievement. People who have trouble separating their sense of self-worth from their physical appearance are at risk of developing eating disorder. Help them by highlighting things you appreciate about them other than their appearance and eating habit. Number 2, discuss healthy way to cope with stress and negative feeling. Children are stressed, depressed or anxious may react by eating too much or too little. Talk to your children about the healthier way to deal with this feeling, such as practice mindful meditation and other stress reduce technique. Remind them that eating well is an important part of self-care, and the good eating habit can ultimately make their stress more manageable. Encourage them to talk to a friend, family member and counselor about what they are going through. Method number 3, understanding the risk factor. First, check for a family history of eating disorder. If you are concerned that your children might be at risk of developing of eating disorder, try to find if anyone else in the family has same problem. But it's not clear what part genetics play in the development of eating disorder. The evidence doesn't support a hereditary element. People who have parents or siblings with eating disorder may be at high risk than people with no family history.